Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 7, 2025. This is a video on an article published in the New England Journal on April 30th, 2025, titled Mepolizumab to Prevent Exacerbations of COPD with an eosinophilic phenotype, and there was an accompanying editorial in the same issue of the journal. There are multiple phenotypes of COPD, and some are listed on the slide. COPD exacerbations are a major clinical problem, especially in patients with eosinophilic inflammation. It comprises 20 to 40% of the COPD cases. Interleukin-5, IL-5, drives eosinophil-mediated airway damage. Mepolizumab, an anti-IL-5 monoclonal antibody, reduces eosinophil levels. Prior trials, Metrix and Metrio, hinted at benefits in eosinophilic COPD, prompting the phase 3 MATINEE trial. The methods: this was a phase 3 double-blind randomized trial of 344 centers across 25 countries, 804 COPD patients with greater than or equal to 300 eosinophils per microliter on triple inhaled therapy were randomized 1:1 to mepolizumab 100 mg subcutaneous given every 4 weeks versus placebo for up to 104 weeks. Primary endpoint: annualized rate of moderate and severe exacerbations. Secondary endpoints: time to first exacerbation, quality of living scores, ED and hospital visits, and lung function. Key findings and takeaways: there was a 21% reduction in annualized exacerbations with mepolizumab versus placebo, p-value 0.01. Time to first exacerbation longer with mepolizumab, 419 versus 321 days with placebo, p-value 0.009. No significant differences in quality of life score responses. Similar safety profile, serious adverse events and mortality comparable between the groups. So the key takeaway: mepolizumab benefits select COPD patients with eosinophilic phenotype despite maximal inhaled therapy, highlights the importance of precision medicine targeting type 2 inflammation in COPD, no improvements in symptoms or quality of life scores, underscores the need for composite endpoints in future trials, supports integration of biologics into COPD care pathway for eosinophilic patients. The accompanying editorial said that mepolizumab shows modest reduction in exacerbations among eosinophilic COPD patients already on triple therapy. No improvements observed in lung function, symptoms, or quality of life compared to placebo. Differences with dupilumab trials may stem from stricter inclusion, that is chronic bronchitis, and dual cytokine targeting. Safety was reassuring, but efficacy limited to non-hospitalized exacerbations only. Limitations: lack of benefit on severe exacerbations or hospitalizations. Variable eosinophil counts and corticosteroid effects may confound responses. Heterogeneity of airway inflammation in COPD complicates targeting IL-5 alone. Need for better biomarkers to personalize biologic use in COPD. Podcast brought to you by Master MedFacts at mastermedfacts.com.